Well, a dream scenario to me would be that we have a system that can unfortunately not tell by scanning the patient exactly which treatment to give when the patient arrives in the hospital, but the target should be that the second dose of antimicrobial should be targeted towards a pathogen. Of course, if you can only make it for the third dose, then this is still better than the 6th or 8th or 10th dose before you modify the treatment. So the earlier we can do it, the better. But I think realistically, we have around maybe an 8-hour slot from the first dose to the second dose with the typical treatment that we are giving. And within that time frame, the target should be that the patient should get targeted therapy. And as I see it, the patient should have the same right to get this result regardless of when he or she falls ill. It should not matter whether it's on a national holiday or whether it's in the middle of the night. You still have the same right to survive. And just because you are unlucky and do not become sick in office hours, this doesn't mean that you as a patient should suffer from another inferior treatment to an individual who would be sick at another time point of the day. This is something we need to decide. I think as a society that this is unacceptable. With AMR, you can be very pessimistic and say that it seems like we are losing the battle. But I still think we have new tools that we haven't to the same extent tried. There could also be ways of addressing carriage of AMR to prevent infections even. So I think we need new and fresh approaches. And at the same time, as there is a certain level of depressiveness towards problems that seem to become worse year after year, it's also, of course, some level of challenge when you believe that there are things you can do to improve the situation. And I think one of the things also that is a strong motivator in all of this is that we have actually now some new antimicrobials in the market. In the past, we were very poor at using those wisely. And this time we have still an opportunity to use these drugs in a more targeted manner instead of just running out of them as well in a short time. And that's a huge responsibility because we cannot really expect that there will be new drugs coming all the time. So I think improving the way we protect the new drugs so we can give them a longer life is also going to be a very strong motivator. And that comes back to finding good ways of testing and reporting them and good ways of working with algorithms under which it's correct to use the most recent drugs we have available.